Welcome to Beyond 2020, a project of the Nebraska Optometric Association. For this episode, we have Dr. Vicky Vandervort from Omaha, Heartland Eye Consultants. I've been looking forward to having you on here because every time we talk about children's vision, whether it's on this podcast or I'm talking with the NOA and meeting with the Department of Ed, I'm always in my mind wishing I could respond to the answers the way Vicky would respond to those answers.
Thank you.
Thanks for joining us.
That's very kind of you. Thank you.
One of the biggest reasons we wanted to have you kind of kick off our children's vision series here is twofold. You bring kind of two aspects to that. And one, if I remember correctly, you actually started out as a teacher, correct?
I did, right here in Lincoln.
Oh, excellent. What level were you teaching at, or what?
So I taught 3rd, 4th, and 5th grade reading, math, science. I taught kindergarten through 5th grade music.
Nice, excellent. That's great. My parents were both teachers, so education is near and dear to me. So that's excellent. And then, of course, your optometry career has been built around vision and learning, different cognitive issues that may arise for children. And you've been one of the foremost experts in our state in regards to that. So thanks again for sharing your expertise with us.
You're welcome. My pleasure.
The whole point of the podcast is a resource for parents. It's a resource for clinics to share out to their patients, as well as maybe some other member groups that we're involved with, whether it's Department of Education or different legislators and things like that. So when it comes to children and learning, I think one of the biggest confusions is a parent may say, well, if they can see 20/20, what do you mean that I need to get an eye exam? If they don't have any problems with their vision, why would I need an eye exam? So kind of go through your response to the undetected things with just even a standard eye exam, let alone a screening that we maybe need to be aware of.
Yes, well, I think of the different levels of exams, like the visual screening, which is done in the school or the pediatrician's office, as really typically being distance vision, which really doesn't screen out any academic issues. It does help for sports, but it really doesn't help for the academic issues that can occur. And so what we really need to be doing is assessing acuity at near, and that could be added to the screenings that the school nurses do. Then I think about what a lot of people call an eye exam, and that is truly examining the eyeball. So we're looking at the acuity or the eyesight again. We're looking at the power of the eye. Does one or both eyes need some kind of lens to be able to allow the child to see far and near at the same time? And what kind of balance is there? And then we're looking at the health, the outside of the eye and the health of the inside of the eye. And a lot of times that's the extent of the eye exam. But if a couple of things were added in to that, then it would be more what I would call a comprehensive vision exam, where we're actually examining the brain's ability to coordinate the two eyes. So does that answer your question?
Yeah. And I think that's where the biggest misunderstanding comes in. So correct me if I'm wrong in how I describe this, but with patients at the clinic, when you're talking about putting a lens in front of the eye to correct vision, most people, I think, patients' perceptions is that that's a static target, right? And conceptually, we're really putting that lens in, and I use the idea of a teeter-totter, and that brings the teeter-totter level, and there is a range that then we should be able to go. And I think that's the hardest part for parents to understand and explain how that system can kind of disrupt learning, even for a kiddo who is literally zero, doesn't need any prescription. So can you kind of explain, you were mentioning some of the things that can be undetected that really can affect learning, even though they maybe had, quote unquote, a full eye exam. What are some of the issues and what might a parent need to look out for?
So beyond the refractive status or the need for glasses and how well the child can see out of each eye, there's a thing that we call I call the visual efficiency, how well the brain can coordinate the two eyes in doing the things that are responsible for helping a child succeed in school. One of them is moving the eyes along a row of words. We call it saccades. Teachers and parents call it tracking. And another thing is the ability to focus up close and then focus far away, back and forth. The ability to have the two eyes point at the same place at the same time. So I think that is probably the hardest thing for people to understand, to think about. When I look at an object, I'm seeing it from two different points of view. And the brain has to coordinate those two eyes so that, you know, you only see one instead of 2, 1, 2, 1. And, you know, asking someone, do you see double, they usually think you mean this, but not something as subtle as that. And when that kind of thing, when that deficit in what we call binocular vision or eye teaming is there, it's a load on the brain. The brain is having to depend on that, and that is paramount. It's, oh, we have double vision, I don't know which is real, we got to get that fixed. And so, you know, that can really take away from the brain's ability to keep the tracking going. It can take away from the child's ability to comprehend.
Is it, so would you describe it, I guess another way that I have tried to come up with describing this for a parent is if the eyes, or the brain more specifically, have to divert their focus to moving the eyes and controlling the eyes, it's sort of like in my world when I click the mouse on my computer and something doesn't happen. So then I click it like 5 times really fast and then the computer just freezes, right? So the brain diverts some attention because it can't do those things efficiently, almost like a reflex. So then that comprehension ability kind of drops and,
Yes.
and you don't retain it.
We call it a load, and if you think about it in terms of an athletic thing, you know, you go running and you can run a certain speed. You add weights on your arms and your ankles, that is a load. You can't do it as well, and that's what that inefficiency of binocular vision can be to the brain. It's not, you know, a physical weight, but it is definitely a diversion of the attention of the brain.
So you kind of mentioned the idea of the shaky letters or the splitting of the letters at a small scale as opposed to full true double vision. What are some other symptoms or things that perhaps a teacher may notice, or a parent, you know, what are questions a parent should ask at parent-teacher conferences, kind of from that side of things?
Yeah, so our eyes should be able to be used all day long with no symptoms whatsoever. And so if you see a child, and I guess the other thing I'd like to say is that children don't know what they don't know. They could have totally blurry vision or no vision, as in one case I had, in one eye and fine in the other, and not know that everybody else doesn't have that. So they don't typically complain. Sometimes when they do complain, they're written off. This thing can cause it to look like the words are moving around on the page, and honestly, I have to admit that the first time I ever heard that, my skeptical nature was like, that's not possible. And then when I started thinking about how the eyes are, I realized, in fact, it is. And so complaining, when they get the words, when they're old enough to be able to put symptoms into words and complain, to not blow them off, to investigate, go to your family optometrist and say, my child's complaining about this. They can complain of headaches, they can complain of eye strain, or they may not complain at all. They may just rub their eyes after they've been reading for a little while. They may avoid reading. A lot of times ADD is misdiagnosed as ADD, when in actuality it's the child trying to do what they're supposed to do for school, and working so hard to do it that they have to take a break more often than their peers. And so the teacher sees them staring out the window, and what they're doing is trying to relieve the strain around their eyes or try to get rid of the headache. And they're labeled as a dreamer, or he's not paying attention, or attention deficit.
Sure. And are there some other behavioral things too that can come out that can be a sign of a possible binocular vision disorder besides ADD? Are there other things that you can be working through? Or?
ADD and vision issues like what we're talking about have a whole host of things in common. And quite often, I would just hand a list of those things to a parent and say, how many of these? Oh yeah, this is my kid. Yeah. And that's why he's diagnosed with ADD, and he's been put on, a med.
Sure.
And then when we describe, even just avoidance, like I don't want to do my homework. I can't do my homework for very long. They sit down, they do it for a little while, they get up and leave. It can be reading and rereading to be able to get the comprehension enough to be able to answer questions that might be on a paper or a test.
Sure.
So, yeah.
Is that something, do you feel like that's something that it kind of takes a team? I mean, obviously, you can look at academics in terms of like a parent-teacher conference and get some feedback on things that are going. That's actually how I got interested in eyes, was from a parent-teacher conference when I was a sixth grader. I'd never actually had my eyes checked because I passed the screening.
Sure.
And you had to take a test to go into junior high of what level of classes you could take. And I talked about it on a previous episode. My math and science was really high, my reading and English wasn't. And so my parents, both being teachers, asked questions, well, this doesn't really make sense with class, and it turned out I had a little bit of exophoria and some things. And
okay.
I got some minor hyperopic prescription glasses that I wore just for school, and it cleared up. But that was obviously because parents asked more questions and got involved too. With our nurses being so involved in terms of screenings at this point in time, seems that it would be appropriate that we need to help educate for other signs and symptoms. Are there some quick things that nurses would be able to pay attention to, or is it as simple as just starting off the kiddos that come in with headaches a lot during the school day? Or
Yeah, so there's a lot of things that I want to say. I just thought of another thing that a parent or a teacher in the classroom could differentiate a potential visual problem, and that would be if you have the child read a book, let's say, and then they answer comprehension questions and do terrible, or they have them read an assignment for science or whatever, and they do terribly. But if the teacher or the parent reads it to them, they are clicking all over the place. So we know that the first way they were getting their information through the visual system, the second way they were getting it through the auditory system and letting the eyeballs rest, but still using the visual system to make that movie in your mind that you have when you read. That little piece of information could be helpful for teachers and parents and the school nurses. I don't know what other doctors would think of me saying this, but I kind of feel like we need to give the nurses who have the best interest of their students in mind. I think the first kids that should go to the nurse are those that have symptoms or complaining of headaches, or people are noticing them rubbing their eyes, or they're reading with one eye covered a lot, and those that are falling behind, but yet they don't seem like they are cognitively below normal or even on the low end of normal. Those are the children that should be referred to the school nurse for sure. And I think this is a part that I don't know how my colleagues will react to this, but I would have thought for a while that it wouldn't be hard to teach a nurse to do a near point of convergence test. And what that means is to take a small target like the tip of a pen, and push it in towards the eyes, and we ask the child to tell me when you see two. And that's suggesting to the child that you will see two at some time, so it's not going to be something that you have to hide from me. Do you see two? Can be kind of intimidating. No, I don't see two, I only see one. And so, you know that you should be able to get within about 2 inches of your nose. And you can tell a lot. I mean, we'd have to teach them what to watch besides relying on the child, but you can tell a lot by how far out that near point of convergence is. How hard are they working? I mean, I've had children that have had single vision at 4 feet. And of course they're reading, so that means they're straining really hard to be able to keep it at 16 inches or 12 inches, wherever they're holding their material.
Sure.
And so to me, that's the next step to go. I don't think we're going to get school systems to buy stereo acuity card tests. I think that's a big ask.
Sure.
Because it's money. But this could be a way our association could help the schools identify children that have something that is fixable.
Sure.
And the other thing that I wanted to say is it's not just necessarily children that are doing poorly in school. There are children that I've seen over my 35 years in Nebraska that very bright, straight A students, but with headaches and eye strain. And, maybe if they're not identified, they don't go to law school, they don't go to med school because it's all that reading I don't want to do.
Sure. It actually guides their career choice.
It guides their whole life, yeah. And so, you certainly want to take care of the children that are struggling. And that's been probably my biggest love of combining my two careers, is my love of kids and my desire to help them, and then helping one at a time achieve that love of reading, get their curiosity for learning back, because they're just not so burdened down by things that nobody recognizes. Teachers and parents, with the best of intentions, are saying, you're not trying hard enough.
Sure.
When in actuality, they're trying very hard, harder than maybe their peer. And that gets discouraging to a child. And so sometimes they give up.
Yeah. Well, I remember you shared a story one time with a group of us about a dad who brought a daughter in, I believe, was this situation. And he, by all accounts, had been pretty successful. I think he was a scientist of some sort. And he was listening to you going through the exam, and maybe it was with Dr. Will, but he asked and wanted to be tested, and then turned out that he did have some binocular vision deficit and went through the program. And he was asking the same question at the end, was like, well, I mean, I am doing this career and doing well, but what else may I have chosen to do at that point?
And I don't remember that particular person, but I mean, I've had a number of parents go through vision therapy after the fact, and one lady was mad, just mad. I knew my sisters were smarter than I am, and now maybe they weren't. Yeah.
One thing that made me think of, as far as the different ways or stimulus, I guess, to use our eyes before we kind of move on to possible or treatment ideas or whatnot. One question I get from parents is, we're talking about fatigue, strain, headaches, and reading, and we talk about amount of time spent reading, and they say, well, they can sit there and play a video game forever and not get headaches and be strained. Am I explaining it correctly to them in terms of, our brain and sight responds to flashes and flicker of light, and so When you're playing a video game, it's kind of like being read to, like you were saying, the auditory system helping us. When you're playing a video game, your brain is responding to the movement on the screen to move the eyes and attract the eyes, versus reading, your brain is having to move the eyes. So it's kind of a different in terms of what that impetus is.
You're exactly right on. And the other part of that is that video games you are not having to produce images in your mind's eye. As you read, you have to do extra work. When you're watching TV, watching a video, or doing video games, it's all there. So there is more work inside. And the short attention span that we've developed as a society, I mean, I see it in myself since we've had the cell phones, and we're used to just little tidbits of information, and make me concentrate for more than 90 seconds and I'm kind of wandering off. That impacts people too. And I know that for a time I didn't read. I used to read 1 or 2 books a week.
Sure.
And for a time I didn't read, and I was like, why aren't I reading? I'd just rather plop down and watch something on TV. And I thought about that fact. And how much I used to love reading, and then I just made myself get into it. And
sure. Kind of give it up for a little bit and go back to the books.
Yeah.
What are some resources for parents? So obviously there can be some costs associated with vision therapy, or even just the basic need of getting glasses. Having been involved in Nebraska for so long with children, do you have any thoughts on some resources for parents who maybe need extra help, or is there places they can contact, or what kind of resources do we have within the state?
Well, I don't know that I'm the best one to ask that, but people who are on state insurance get their everything from the Medicaid insurance. It's the people that have no vision insurance but health insurance that are probably in the worst position. Lions Club supposedly helps people, but I don't really know. I don't have,
sure.
I'm not in primary care, so I really don't know. But most optometrists that I know have the best interest of the patient at heart, and usually have a range of frames and a way of reducing the cost of the lenses. Churches, church groups, will help for glasses. And
yeah.
Is that,
how about with any resources for like VT that you're aware of, or stuff like that?
So I don't know what individual offices do, but I suspect that most offices do what our office does, and that is we always feel like we're the advocate for the child, and it's our job to help the parent understand what we know about what's holding them back. And there are really 2 big barriers in treatment there. 2, I'll say. One is time that it takes to change the brain, because we're not, this is not just a click and we're done. It's much like learning to play an instrument. You have to learn all the notes, you have to learn how to finger if you're playing a flute. It takes time. Or if you're learning how to play golf, it doesn't matter what it is. Your brain has to take the time to learn it.
It's kind of like physical therapy. In terms of you got to keep up with it, otherwise.
Yeah, and it's actually, it is similar, although it's not muscles, it's one muscle, and we're changing the neural pathways. So there's the time that it takes to make that happen. There's a time that it requires a parent to help the child, because a lot of these, if we're lucky, we get them at 2nd grade or 1st grade. Before they've gotten to the point where they think they're stupid. And so the parent's heavily involved, a 30-minute a day commitment. And if they have other children, if they're a single parent, it's a challenge. And then the cost of it is a challenge as well. And so what we do in our practice is we have to assess in a way to find out, is it something you can't pay for or something you don't want to pay for?
Sure.
Because we have to be able to make enough money to stay doing this.
Yes.
But we will often find out what it is they're able to pay and make it work for them, either by helping them by us supplying sessions, and we come to an agreement.
Oh, that's great.
Because we do want to make sure that the children get the help.
Excellent. Well, you also happen to be here for our first time that we're going to throw in the monthly question that's been submitted to us, and we have to come up with an answer. So the first question that we're going to come up with actually goes very well with what we're talking about at this time, and that is, if my child can't even read letters yet, why would I bring them in for an eye exam, or how would you test their eyes if they can't read letters? So how would you answer the question?
I want to back it up 5 years or 6 years. First of all, I do have to say, as a teacher and with a child development degree, that nobody should be freaking out if a child can't read or identify a letter in kindergarten. It could be normal in the normal development. But I like to see children examined between 6 months and 12 months of age. And you know, our National Association has infancy. And the reason I like that is that it's going to get the most farsighted children, the children that are at risk for eye turns, identified before it becomes embedded and before they live their whole life like that. So I like to see an exam in that second 6 months of life. I know we have also, if that's missed, a 3-year-old exam. That in between 12 months and 3 years of ages, I will admit, having only done children my whole career,
sure,
very challenging. And so, you know, the 3-year-old is a good time, but for sure, right before kindergarten, it should be, there should be a comprehensive vision exam so that we know that there isn't an issue.
Sure.
But allowing for developmental differences, you know, you don't freak out if they're not learning. I've seen over the 35 years I've been in this career, 30, more than that, but in Nebraska, it go from my kid can't read, I'm worried in 2nd grade, my kid can't read, I'm worried in 1st grade, to then kindergarten.
Sure.
And when I say, I can't fix normal, I'm sorry, the parent is not very happy with me.
Well, excellent. Well, thank you. Well, we appreciate you spending time with us tonight and going over something that you've spent your both careers kind of working with. So thank you very much.
Thank you for having me.
We also would like to give a thanks to the Nebraska Optometric Association and the Executive Director, Dave McBride, Beyond 2020 producer, Christian Anderson with Right Eye Digital, Parsons Public Relations. We do want to encourage everybody to look for the latest episode of Beyond 2020 at bettereyecarenebraska.com, on the NOA YouTube channel, and all your favorite podcast platforms, and also follow us on Facebook. If you have questions, please contact us at Nebraska Optometric Association. Until next time, thanks for watching and listening.